Hello and welcome to Docnote. In this video, I'll walk you through a step-by-step guide on how to use Docnote and how each feature works. If you'd like to jump ahead to a specific section of the video, please refer to the index with timestamps on the next slide. Let's get started on your Office dashboard. This workspace displays all incoming and outgoing requests. You can easily filter requests by user, active or archived, or search by patient name or request number. Each request is clearly categorized by status, helping you stay organized and maintain an efficient workflow. The Patient tab provides a streamlined way to manage all your patients in one place. You can filter patients by status, subscribed, active, invited, or disabled for easy navigation. To invite your patients to your Office account, invitations can be sent individually or in bulk using a CSV file exported from your EMR. Simply upload the file to Docnote, and an email invitation will be automatically sent to each patient, guiding them to join the platform. Let's take a look at our next set of tabs under Office Management. This is where you'll find everything related to your clinic's setup and visibility, from account settings to service configuration and beyond. The Office Info tab displays your office profile, including general details, contact information, additional notes, and office hours. While patients will only see your posted office hours, you have full control to update them at any time, and can temporarily close the office if needed. If your office is marked as closed, patients attempting to submit a request will receive a clear message that their requests will be processed upon return, helping manage expectations. The Billing Info tab shows all your payment and fee details, while the Legal tab contains Docnote's terms and conditions for your reference. This is your Office Team tab. Here you can manage your team's accounts, roles, and permissions. Let's invite a new team member to your office. Enter in their details, input what job title they hold in your office, assign their Docnote role and associated account permissions, and click Invite. Your team member will receive an email notification prompting them to create their Docnote account. It is recommended that each team user has their own account. You can edit your team member by clicking the three dots to the right of the screen. If you need to disable them, you can select Disable User here as well. You can easily manage all your third-party contacts, such as insurance companies, lawyers, and pharmacies, within the Contacts tab. These contacts are readily available when creating a request or when a third party needs to be copied on a request. The Forms tab serves as a convenient library of frequently used PDF forms, readily available for download whenever needed. If your office has specific forms you use regularly, we can easily add them to your personalized library for quick access. The Finance tab provides you a clear view of how your uninsured services perform month by month. The financial contribution is tracked automatically, and you can see how many services were completed that month. Docnote breaks down exactly how many requests were completed. Whether it's sick notes, disability forms, or insurance reports, you have visibility into it all. And for offices using Docnote's annual plan feature, the dashboard goes even further. If you have an annual plan, you can track your metrics and income here. The Accounts Receivable tab provides a clear overview of all outstanding payments, including how long they've been due and the total amount owed. The final section under Service Management gives you access to everything related to the uninsured services your office offers, including service details, associated fees, and annual plan models. The Services tab displays all the uninsured services your office offers. Docnote provides preset fees based on OMA guidelines, but you have the flexibility to customize pricing to suit your practice's needs. Docnote offers ready-made service templates that you can easily copy to your office, or you can create your own custom services. When setting up a service, you have the option to feature it on the Patient dashboard as part of your uninsured services list. The Fees tab is where all additional fees can be managed. These are extra charges applied to a service. You can use Docnote's built-in templates or create your own. For example, you might add a fee for a medical review of records, allowing you to apply your physician hourly rate. The Plans tab allows you to activate and customize your annual plan. You can set your own rates and choose which services are included. Patients have the option to subscribe monthly or annually and will be prompted to join the plan whenever they pay for a service covered under it. And there you have it, you've successfully completed your first Docnote training session. Be sure to check out our next videos to continue learning how to use Docnote to streamline and manage your uninsured services with ease. If you have any questions, our support team is here to help. You can reach us anytime at support@docnote.com or by phone at 1-866-236-6172. Thanks for watching. We're excited to support you on your Docnote journey.